Thank you for joining us today for this edition of Pagosa Local News. My name is Gabrielle Dorr, and I'm here with Dr. Heidi McMillan, who is a pediatrician at the Pagosa Medical Group. Heidi, tell me about your background. I know that you come here once a week, but then there's a lot of other things that you do and that you have experience in.
Yes. Hi. Nice to meet you. I am a pediatrician who's been working in the field for approximately 18 to 20 years. I'm originally from back east and had a National Health Service Corps commitment that brought me to rural Utah and then Durango. I worked as a pediatrician in Durango at Pediatric Partners for 10 years prior to branching out into what I'm doing now. I wear a couple hats right now, one of which is general pediatrician at Pagosa Medical Group, which I love. And another hat that I wear is medical director for 9R School District, which is a new position and with layers of complexity amid COVID right now. In addition, with the 9R School District, I have started a pediatrics practice that's focused on mental health and behavioral health in order to close the gap in our community around behavioral health needs. And this is the office where I am right now on campus at what's called the Hub in Durango. And that's where we are piloting a new therapeutic day school for kids with behavioral health and mental health needs. Today, I'm talking to you mostly from the standpoint of my medical directorship with the 9R School District and how that can be generalized to other communities.
So you are working with Durango 9R Public Schools, right, that you mentioned?
Yeah.
And you're actually advising them on their reopening for the fall. Can you tell me more about what that involves and what kind of where you're at right now with that?
It involves lots of meetings and long hours, and it's really important work. What my aspect has to do with the public health aspect and safety, and really interpreting the CDC information, the American CDC Center for Disease Control information, the American Academy of Pediatric information, into a way that's kind of distilled into a format that can be actually put into practice. And we wrote a very detailed back to school return to learn program that's 52 pages long. And my aspect is really the public health aspect and where that also overlays with the different departments, et cetera. So it's a situation though, where, once you kind of dive in deep with this and you set up the boundaries and the framework based on evidence and best practice, you find that there's new questions that arise as you go through these tunnels. And my role is to kind of assist the different departments.
I know that there's a lot of information out there, right? And then it's changing constantly. So what is the data that you're really using right now to make the decisions about returning back to school?
The main data has to do with whether a community has minimal transmission versus sustained transmission. Minimal versus moderate and sustained versus severe. Basically, there's consensus as far as best practice around reopening amongst epidemiologists, and the data that they're providing is what we're using, and the recommendations around that. You'll hear a number of kind of concepts being thrown out as far as reopening. One of them is percent positivity rate, and that has to do with the number of positives for those who are tested, and obviously has to do with if you're not testing very many, it impacts that. The overall in our state, we're testing enough for it to be statistically significant, and the some communities are reopening schools with a threshold of 10% positivity rate, lower being better. Some are using 5% as a threshold. Currently in Colorado, we're at 3.7, and we've been pretty stable there for a while. I really think that the mask order has made a big difference in what we call flattening the curve. And I think people have heard that enough that they kind of understand what that means.
So you're looking at it as the state of Colorado, not necessarily by county.
No, I'm also looking at it by county.
Yeah. Okay.
And the latest data from Archuleta County, I think but it's what I've seen most recently for Archuleta. What's published on the health department is actually about a week to 10 days old, but the percent positivity rate was 1.77, I believe. I'd have to look that up, but it was below 2. As far as La Plata County goes, it was 2.77. We're well within the recommendations of being able to reopen. There are actually two real truths here as far as what's important. And one is that this disease is extremely serious and needs to be taken seriously. And safety is the paramount importance as far as going back to school. The other truth is that we have kids struggling and suffering by not being in school. Some educationally, especially kids who require services that they can't get at home. Some from a standpoint of food scarcity. The districts have worked really hard on getting food to those kids who are on free and reduced lunches. And I think that we're seeing more of those because of the economy. And I think we will see even more of that as the PPP loans settle out, and we'll see families suffer and we'll see kids suffer as a consequence. So we have these two truths, and we really need to be able to figure out a way to forge ahead in a way that we are maintaining safety, and that requires diligence and employing evidence-based practices and recognizing that not doing something has its severe risks as well.
So I was curious about, you said you want to make sure that, everyone has a good comfort level. How are the teachers doing with all of this? Are they, are they comfortable?
Teachers really, they're impacted because they're really essential workers, and never thought they would be when they went into teaching, probably, as far as public health standpoint goes, and they're thrown into this world that's very different than what they anticipated. Some are more comfortable than others. I do feel, my philosophy is that teachers need to be supported as essential workers, and given everything they need to be able to succeed. So what we're doing is trying to communicate as best we can. It's such a fast-moving information pool, and things change. We've gotten information from the state, and we keep getting information from the state, which guides what we're doing, as well as the CDC, as well as the AAP, as well as the Children's Hospital. And we're trying to communicate as quickly as we can. That's something that I've really been working with the administration too on, how can we be cognizant of the anxiety that this causes, not just in the community, but in the teachers coming back.
What advice would you give a parent who's really struggling with trying to figure out if they should, let their kid go back to school or not, or, just do distance learning?
So very good question. I think the most important thing is for parents to familiarize themselves with the different learning styles and what their district plans to do. And once they're familiar with that, kind of look at that through the lens of what their child's best learning style is, and then add in any other factors, whether they're medical factors that could put the child at greater risk than his peers or her peers, and speak with their doctor if needed as far as making that final decision if there's any concern about greater risk factors.
And then I don't know if this is too broad of a question, but from your perspective as a pediatrician, in kind of witnessing a pandemic, what else would you like to share about what's happening right now?
That's a big question. Continuing to look for the good and look for the beauty in the world around us. We're very lucky where we live because we have so many ways to get outside and to see other people. The other side that as a pediatrician, that I like to reinforce is the need to be vigilant so that it becomes second nature to us. I think it'll be less difficult when a mask feels like a seatbelt. For many of us, if we don't have our seatbelt on, we feel like we're missing something. And I think that once we get to the point where these systems, these new habits are second nature, then we are able to more easily get into the area of just living and enjoying and taking advantage of everything we have.
I just want to thank you, Dr. McMillan, for joining us this morning. That was really informative, and thank you for bringing your experience to help our schools and our teachers and our community be safer.
My pleasure. Thank you very much for having me.
Thank you for watching this edition of Pagosa Local News.